Well, as I told the kids, I had opportunity to hear you speak up in Wichita back in September, and I felt like the message was one of hope and encouragement, and that it was important for our school-age kids to hear that. We have a number of kids that are struggling with issues, and we're trying to do some suicide awareness. We've got kids that through our crisis department we have learned are attempting suicide or having those kinds of thoughts, and I felt like if we could just break through that communication gap and get people talking, that we would gain some traction and help these kids out. The other thing that I was really impacted by was just the fact that you emphasize in your presentation the importance of understanding and being aware of how we impact others, even those that we don't know, and that walking past someone can be abandoning, even if we've never met that person before. And then just to be conscientious enough, be aware enough to say, hey, are you doing all right? Is there anything I can do? Can I point you in the direction of a resource? That if that saves somebody or minimizes some of the pain or agony that they're going through, that is so simple, and the kids need to know that they have the power to do that. And so it's been very gratifying to me to see almost 3,000 kids over the course of 3 days hear that message, and they embrace it. You know, they are impacted by that, and that's exactly what we wanted to see happen. So that's my motivation in making sure you had access to these kids.
And we brought Joseph Williams over here. You did from Australia.
Yes.
And he spoke about his story, and how do you feel that impacted the kids?
I think that Joe's message was very important for them to hear, because he has some just very pragmatic approaches to how he manages his own health and well-being, and to arm the kids that are feeling something in the audience to say, hey, go home and just do these 3 or 4 things. Get you through the day, get you through the week, connect with some resources that you need, but do these things in a disciplined way. That's just as good as it gets when it comes to having a toolkit that they can operate with. And so and his accent doesn't hurt. You know, that gets people's attention, and it makes them listen intently. And of course, again, his background as an athlete captures some attention. So yeah, it's a good message.
Good message, that's right. And the girls giggle when they hear his accent.
Yeah, that's right.
It's hilarious. That's everywhere. That's the adults as well, by the way, when we go to conferences. But anyway, so we're looking at that, and we see that we've reached 3,000 people, human beings, a lot of them in a lot of pain.
Yeah.
Particularly the very last presentation we had.
Yes.
We had a plethora of kids come up, because at the end of the presentation, I said, not just if you want to ask questions at the end, but if you're hurting, stay with us. We want to guide you to the right people that can get you help. And so many kids came up. What was your experience there?
Well, that was a little overwhelming, quite frankly. We had the 4 of you that are traveling and putting this program on for us. We had 2 counselors from the school, myself, and one of my employees who is a therapist in our children's program, and we all had kids lined up behind one another to have access to what we could point them toward in terms of resources, to encourage them, to give them that hug, to just let them know that we are in their corner. And in the first day that we did this, we were over in Winfield. We had a very large response, kids very positively reacting to that message, some in need. I was kind of overwhelmed by that experience, because it was the first time I'd seen that many kids just come forward with that level of interest. The level of trauma at the last school we were at was just pretty amazing, pretty disheartening, quite frankly.
Yeah, it was pretty scary to see the different things they were all going through.
The good thing that came out of that is that high school is in the catchment area of my organization, and I now know the depth of need that is there. And before we left that building, I had a conversation with the school administration about our opportunity to put a therapist in that building, at least part-time, so that we can get intake services immediately to the kids that aren't otherwise making it to our clinic, because our clinic is only 4 blocks away from that high school, and they're not making it there. But I had 3 of them tell me, oh man, if I could do this at school and people wouldn't see me walking into the mental health center, I'd do that right away. So we got plans. That changed our business model and our service delivery system for that town.
Wow. So we've seen and heard about the trauma. We've seen and heard from kids who appreciated the message. I even heard from a teacher about 10 minutes ago who had attempted to take his life years ago.
So am I.
And that he was in a bad state of mind today, and it helped him feel the ability to keep on keeping on.
Keep going. Wow.
Keep going.
That's
So,
great.
so we have an array of things happening here after you brought Joe and I here, and we've seen some beautiful things occur. We've heard about some very deep trauma, and we're going to continue. We go to Kansas City. We drive there tonight. We speak there tomorrow. I guess my next question, Greg, is can you just tell us a little bit more about Fort County and what you're doing?
Sure.
And what it's all about?
Yeah. Fort County Mental Health Center is a community mental health center. We're designated by the counties that we serve as their mental health agent. Each county in the state of Kansas needs to have a county health department for physical health needs and public safety, public health needs. They also need to have a county mental health department. Well, rather than create bricks and mortar and have their own staff for mental health services, they essentially contract or designate that out to our organization. We're a private nonprofit, and we act on their behalf as that mental health agent, and we deliver services, crisis services 24/7. We do outpatient therapy. We've got psychiatric services. We have case management, kind of life coach types of services for both adults and kids. And we do parenting classes and peer support services. We've actually got about 43 programs overall in our organization. And even though our name is Fort County Mental Health Center, last year and a half we merged with another mental health center that was struggling. And we have 5 counties for Fort County Mental Health Center. Haven't changed our name in any way yet.
4 to 5 counties.
Yeah, 4 to 5 counties. 4 plus 1 county mental health center.
I like that.
Anyway, we just really look to serve whatever need there is or gap there is in the mental health care, and have been doing it for a little over 50 years in terms of the agency. I've been there a little over 27 myself. So we're 470 employees strong, and everybody there has a mission. They're there for the right reason, and that's what makes it so easy to stay there for 27 years. Is the culture of that company is where it needs to be.
And how do people find you online?
FortCounty.com, www.fortcounty.com, FOURCOUNTY.com.
FOURCOUNTY.com. Check them out if you live in Kansas or the areas near Kansas. And thank you very much, my friend.
Thank you.
Thank you.
Appreciate the opportunity.